Hi, this is Dr. Victoria Andarcia. Thank you for joining me again on the Healthful Roots podcast. Today, we're going to be getting into some pelvic therapy with Dr. Aryn Delaney, and I will just let you go on and introduce yourself to the group.
Yeah, thank you. So I'm honored to be here. Thanks for having me. My name is Aryn. I am a physical therapist and I specialize in women's health and pelvic floor dysfunction. I own Warrior Physical Therapy and I'm located in Sarasota. So I have a clinic that you can come in person. You can do virtual sessions with me. But basically, what I do is I treat a lot of the things that people don't want to talk about and things that make people feel insecure or, hush whispered voices, hemorrhoids, and prolapse, and organs coming out of your body, leakage, constipation. So a lot of the topics, pain with intimacy, that people aren't necessarily sure who to ask. I have tailbone pain. Who do I go see? I have pain with my menstrual cycle. Who do I go see? So a lot of times it is primary care physicians, OBs, GYNs, functional medicine practitioners that are a great bridge to guide people to the right place. So I just wanted to try to educate on what makes you a candidate for pelvic floor and, educating that we exist to begin with, to come seek further help.
Yeah, and I think that's so important because even as a medical doctor, I never really understood what pelvic therapy was until pelvic therapist reached out to me and was like, hey, can we sit down and talk? And then I was just like, wow, like we're missing like this really big piece, right? Especially for anybody who, sees patients in general. So what exactly, is pelvic floor therapy? What is the pelvic floor? Uh, just get into a little bit of that.
Yeah, so the pelvic floor is a group of 14 muscles that connect from, if you're watching, pubic bone that goes all the way to tailbone and also comes across from your sit bones, your ischial tuberosity. So it's the bottom of the pelvis, basically, that's holding your organs in. The role of the pelvic floor, there's 5 main functions that the pelvic floor does. It's sphincteric, which means it opens and closes urethral, vaginal opening, and anus itself. So anything in and out, we need the pelvic floor to get out of the way to make sure that we have that sphincteric control. Sexual function, it's a big stabilizer of the lumbopelvic region because it attaches at the hip and where that spine meets. So it's a really big stabilizer. It's a support system for our organs. It holds the organs in our body throughout the time. And it's also called something called a sump pump, but basically it pumps lymphatic fluid and blood flow in and out of the pelvis. It helps draw fluid up from the lower extremities, from your legs. So if there's any kind of swelling in the lower abdomen or in the groin, in the lower leg, this is a really powerful muscle group that will help continue with circulation.
Okay, so this was one of my later questions, but I'm going to jump in and ask it now since it kind of makes sense now. So since we're talking about like the anatomy of it, what other things kind of, I don't know, I don't want to say like interfere, but go along with our pelvic floor? Like, does breathing affect how we connect with our pelvic floor muscle? Does posture? Do we have to be careful with exercise? Like, how do the things that we do on a daily basis go hand in hand with the pelvic floor health?
Yeah, so what pelvic floor therapy does and what can interfere and create cause symptoms is basically we are looking at the whole body. So when you see a pelvic floor therapist, they're not only doing internal work. We're not just looking at your pelvic floor. We're not just looking at leakage and treating leakage because you have it. We have to get to the root cause of where that even came from. So that goes from a full head to toe assessment. So what we're looking for is your posture. So if we have rounded upper back, for instance, what that does is it affects our rib cage angle. And we have a narrowed rib cage. Maybe one side is really narrowed, one side is really flared. That affects how the abs are working and how your pressure management is going to be affected, which then goes down to the pelvic floor. And we can look also reverse up the foot, the ankle injuries. If the foot collapses and goes into pronation, that creates a rotation effect that shows up in the hip, and then the hip then plays into the pelvic floor. So your pelvic floor are primarily external rotators, meaning if you push your knees out, feet together, knees out into like a butterfly position, that is what your pelvic floor does. And that's a lot of times what we do in the gym. That's what we do in athletics. We never want our knees to bow in. So the cueing is push your knees out, push your knees out. And we're overdoing external rotation. So a majority of my people have tight pelvic floors. I would say very high percentage would be tight. This can come from many things. So when we're looking at pelvic floor therapy and things that interfere and how it shows up, It can be multi-systems involved. We have your GI tract, we have your central nervous system, sexual reproductive, we have musculoskeletal. So if you're seeing chiro, you're seeing massage, you've done traditional exercises, but you can't get rid of your hip pain, pelvic floor is a missing puzzle piece because there's a significant amount of muscles at the base of the pelvis that a lot of practitioners are not trained to evaluate. So OBs, GYNs, like they go into the speculum, they're looking at your organs for infection, for cancers, things of that nature, but we're not necessarily testing the muscles like we do. So we are looking for coordination, like you mentioned with breath. Your pelvic floor is a diaphragm. So we have a diaphragm in our throat, one in our abdomen that we're familiar with, and your pelvic floor. So when you inhale, the diaphragms drop down. When you exhale, they come back up again. So a lot of us are not ever taught to move the pelvic floor down. A lot of us are taught to contract and to pull up and suck in your stomach, wear high, tight-waisted pants, stress. If we breathe into our chest, we're doing that reverse breathing pattern. So there are so many things that can lead us to a hypertonic or a tight pelvic floor. And tight doesn't always mean strong. So then we have to look at strength separate. First, can you even move your pelvic floor before you contract it? If it's already in a shortened position, there's not much more space for it to go. So sometimes that can be actually misdiagnosed. They don't have a Kegel, they don't have any strength. Go do some strengthening exercises, YouTube strength, and and then you don't need. You want me to pause?
She'll finish in a second. Okay. Okay. Unless she's scared. Hold on. Let me make sure she's
Okay.
okay. Lena? Okay. Sorry about that.
Yeah.
Okay.
So a lot of times we think we're weak, but we're actually in a state of tightness and hypertonicity. So if you just go to YouTube and you just look up how to strengthen my pelvic floor, you can be exacerbating your symptoms because no one taught you to move your pelvic floor down before you move it up. So if we just tighten, it's like that elbow effect, like you run out of space and then you can exacerbate your symptoms. So pelvic floor really is going to break down how is your system working together? Is it working on autopilot like it should, or has it lost that communication of that coordination and the body's all out of whack and other muscles are trying to make up for it, which is now presenting as hip pain or presenting as lower abdominal discomfort or constipation, leakage, prolapse. That's where we start to see a lot of pelvic floor symptoms come to the surface, but it's not always root cause.
Right.
So we try to
Right.
bring.
And I think that tends to be like what's marketed is more of like, oh, do Kegels and strengthen your pelvic floor. And I didn't realize how prevalent, like where you're talking about the hypertonic, what do you call it? Hypertonic pelvic floor?
Yeah, hypertonic pelvic floor, just like a lot of tension and through these muscle groups.
Yeah, and that was interesting because I've done pelvic therapy, and when you're talking about having like a connection, and like it was like we are doing breathing exercises and just like finding the coordination. I had like no coordination. It was like
Yeah,
so hard. I had to like think like, okay, breathe out and like lower your pelvic floor. It was like so hard for me to like find that, which is interesting because you would think that it would be second nature, but it wasn't.
yeah, and I don't know about you, but in PE, I mean, or yoga, like I was encouraged to like breathe up and in. After you run, don't lean over. If you have a cramp, stand up straight. You're supposed to lean over. It lets your diaphragm go, lets your lungs expand more. So I feel like even the way we've been groomed through
Mm.
um, just our upbringing, sometimes kids have pelvic floor dysfunction and then it's presenting their 20s, 30s, 40s. And it's like, hang on, I'm not 80. Why do
Yeah.
I symptoms? They could have been stemming from childhood, only having one bathroom in a classroom, for instance. A lot of us held, pooping. We didn't want to go in public, or the smell, or whatever the case was. If somebody falls, a really big indication of pelvic floor dysfunction is if you fall on your butt, even when
Mm.
you're 5. If you had any kind of tailbone falling situation, which a lot of us some point in our lives have fallen,
Yeah.
that creates hypertonicity right there. Any tailbone injury or any falling on your butt is a really big indication that you need pelvic floor therapy.
Interesting. Okay. And then what about like stress and emotions? Because I've read that you can store stress and trauma in the pelvic floor. Is that true? And how does that work?
It's very true, and we see that in, if you're familiar with the vagus nerve, we know it plugs into all the organs that we need to sustain life. It's, it takes us out of fight or flight and into that parasympathetic rest and digest. But what a lot of people don't know is it ends in your pelvic floor. So when our central nervous system is upregulated, we see that show up in the pelvic floor. And some people might resonate with, well, when I'm nervous, I have to pee all the time, or I have nervous poops, or I must have a weak bladder or a small, I hear that all the time, a small bladder. It's like, you don't have a small bladder. It's very common to have a small bladder, but the central nervous system, I see a lot in here through sexual trauma. I see through miscarriages or abortions. After operations and surgeries, there's traumas that occur that the muscles don't feel safe anymore. They get very guarded. So when we feel fear or heightened emotions, we can see the body start to tense and grip as a protective. And that kind of goes into that fight or flight. Am I going to stay and fight, or should I prepare to run? And when we prepare to run, what muscle do we use? We use our hip flexor. So the psoas is a really tight muscle on a lot of pelvic. And sometimes when we get in to release the psoas, we call it the most emotional muscle because it can make people cry, not only from pain, but it's an emotional release. When we get into certain muscle groups, if you are storing trauma or storing emotion in the pelvis, that is the group that usually, especially women, protect with, and we grip and we just hold it all together. And once we start to explore the pelvis more and more in depth, literally from the sense, we start to find releases. And I have a tissue box always on hand because the tears sometimes follow depending on what the person has gone through.
Oh, it's very interesting. And with the talking about the psoas muscle, I just went to see Sandy a couple weeks ago. So she's a chiropractor. One of the episodes, she's on there. But what's interesting is that I've had lower back pain, and I've tried massage therapy. I've like tried so many different things, like stretching, yoga, and it'll feel good for like 5 minutes. But then when I went to go see her, she was like, "Oh, like your psoas, that's like really tight, and that was causing my lower back pain." But like nobody really goes in there, right, to like
Right.
see or like release it, and it's felt so much better since. But I think that I mean, there are so many symptoms that we think, oh, let me go get a massage or let me go do this, but it's actually an indication of something else.
Right. It's your body. It's an imbalance of some sort. Not everybody has a headache every single day, or you don't have to stretch your bicep every single day. So when someone comes in and they tell me I've had tight hip or hamstrings my whole life, why? You shouldn't have to stretch a hamstring every single day. So what is leading to that muscle continually tightening, tightening, tightening? Once we go that next step, instead of like, oh, you have tight hamstrings, go stretch them every day for the rest of your life. That doesn't fit for me. So then I dig deeper. We need to look at the mechanics. How are you standing? How are you sitting? So when you come in to see pelvic floor PT, we don't just treat your one symptom or your symptoms that you come in with. We have to look at the whole body and how is that playing into your symptoms.
Yeah, so it's root cause medicine, but root cause pelvic therapy, and yeah, it's the whole body.
Yeah, and there's muscles in your pelvis that refer to your hip and your low back that people don't even know to assess. Obturator internus is a huge trigger point that refers to hip and low back and is primarily assessed and only able to access internally. So that's a really big one after some people who have hip replacements or some people that have these hysterectomies or different types of surgeries. And they're just like, I can't get rid of my pain after my C-section or after this, that, and the other. The obturator's on fire. I mean, it's a rock. And that relieves hip and low back pain, even though it's in the pelvis.
Hmm. Okay. So then, since so much is involved, what does a pelvic therapy consult look like?
Yeah, so once you come in, I do try to get a thorough history so I can start to navigate where to start my assessments and looking. I do ask a good amount of questions because some people don't make the connections that I've seen. So I do try to be thorough with my questions. And then I get you down on the table and I'm going to do an assessment of your abdomen. I work heavily in the abdomen, so I am looking at your ribcage angle. I'm looking to see if you have any connective tissue restriction in the abdomen. I do cupping a lot. I do a lot of deep tissue work in the abdomen itself, which I feel like nobody actually touches your stomach, which is where all your organs and where a lot of things are coming from. So making sure there's no restriction in the abdomen. I do check Posture, like we talked about, we'll look at your hip strength. And then if when the person is agreeable, we can do an internal. So what the internal does is it's like washing windows on both sides. It just helps me get a better view. So if I were to tell you like, hey, relax your pelvic floor, and you're like, what does that mean?
Yeah.
Okay, do a Kegel. It's like, yeah, I don't know. I think I'm doing it. I'll be able to give you that feedback. Yes, you are. No, you're not. Let's try this. There's so many cues that work differently for people. So really try to get you to sense it. Once the brain senses what I want it to do, it'll go back on autopilot, which is where we want it to be. We don't want to constantly think about our pelvic floor. It should be working in the background. There's a reason it's not anymore. So that's where I try to get that cueing and that feedback so the brain can actually sense what we want it to do to start learning, oh, okay, I can do this on the background again. Go live your life.
Right. Okay. And so for people who are nervous about pelvic therapy because they might think that, I don't know, it's like a gynecologist's office and you have your legs up in stirrups, which seems like really invasive. I found it to be different. So I have multiple questions. One, is it possible to do a pelvic therapy session and not have to do any internal work?
Absolutely. We can do so much externally. We can do external release of the pelvic floor. And again, we can work in the abdomen, we can work in the legs, we can do a lot of releasing. And what we can also do external is breathing. What our breathing does is it moves your pelvic floor, but you are in control of it. So you are technically moving it from the inside if you get the breath work correct. The beneficial part to the internal is I can give you that feedback. Yes, you're doing it right. But there's other ways we can check to see if your pelvic floor is moving from the outside. So hand placement helps. There's feedback tools. So any way that the brain can sense like, yes, you did that correctly, the body will start to remember that.
Okay. All right. And I think that's helpful for a lot of people who might be nervous about going to see
Yeah.
uh, a pelvic therapist. I think that's something that is hard to understand, but you've done a really good job of clarifying that. All right. So since we have some time, I did want to go into something that is a little bit misunderstood in the traditional medical. Um, just a little bit about interstitial cystitis, and then how can pelvic therapy help that?
So interstitial cystitis is like a breakdown of the lining of the bladder, and it can have really debilitating symptoms that can be burning, sharp pain, urgency, and frequency. It can be really debilitating, I'd say, for a lot of my patients. So the way that we come into it as pelvic floor therapists is to try to help offset your symptoms. So once we identify what triggers are, which, as you mentioned before, stress, heightened emotions, central nervous system is a really big contributor to IC and how flares can occur. So we always want to make sure we're addressing triggers for the bladder, what can agitate the bladder that we ingest. We want to do a multidisciplinary approach with IC for sure. So we're going to want to touch on central nervous system. We're going to make sure that we're not eating or drinking things that are going to be bladder irritants. That we're managing stress, but also tension in the pelvic floor. So when you have heightened pain and burning and urgency, the muscles have to continue to contract to empty the bladder or to hold in urine or to, because of pain, we guard. So what pelvic floor therapy also does is it downregulates the central nervous system to help relax the muscles. So we want to offset tension because we just get really guarded and protected because of the burning and the amount of times that somebody might have to go to the bathroom back to back to back is continual contraction. So we need to actually relax, downregulate, stretch, big inhales, big breaths. How can we offset the symptoms that you're experiencing? Not only can we prevent them, but if you are in a flare, how do we get out of a flare?
Yeah, that's interesting. How much there is to help people who have interstitial cystitis, because I remember being in residency and like one of the doctors being like, "Oh, that's in their head," right? And we just like know that it's so real now.
Yeah. Yeah, it's so real. And unfortunately, you can be, I'd say, quote unquote, in remission for, however long. And then you have one holiday or you have you decide to drink some alcohol or just live your life a little bit. And then all of a sudden you're back in this big flare. I think hormones play into it also. I saw that just based off a patient that I saw. She was taking hormone supplements and then she stopped cold turkey and her interstitial cystitis came out of nowhere and she was in debilitating pain. She couldn't get out of bed. And sometimes just stopping hormones abruptly and not weaning off, I think absolutely affected her after her regimen. So I think there can be a multidisciplinary approach for this, but
Yeah.
pelvic floor PT is one of the grade A first options for treatment.
Yeah. Okay. Well, I hope everybody's thinking like, oh, I need to see a pelvic therapist for fun. I mean, I think everyone would benefit from it. You don't know how many people I refer and they're like, what are you talking about? Why do I need this?
I
Um,
think, yeah, at least once a year, just see, are we good? And then I teach my patients when they're done, like, when you do your breast exam, do your pelvic floor check. Are you good? Great, move on. If you need to work on it, we can be preventative instead of you getting a diagnosis and dealing with it, where you need multiple sessions instead of one.
well, and there's something that you said when we met, and it was about, well, and you also said at the beginning for like pelvic floor, like organ prolapse, right? I have a lot of people who come to me, and the first option that is brought up to them is like, you need to have surgery, right? And nobody ever says, like, go see a pelvic therapist first. So, how can pelvic therapy help someone who has that?
Yeah, so prolapse is coming from some descent of the pelvic organs. We know your organs are suspended by ligaments, so there should be some movement with the organs. But childbirth is a real big cause for prolapse. But 56% of women, is what we're seeing in research, have at least a stage 1 prolapse without having a baby. And this can come from chronic constipation. This can come from heavy weightlifting, poor breathing mechanics, holding your breath and bearing down. So we're starting to see that there is a little bit of descent even in people who have not had a baby. So when we get that descent of the muscles, the bottom third of the vaginal canal has the majority of the nerve endings. So on a regular day, you would not sense where your organs are in your body because that's not where the nerve endings are for you to be aware that your organs are even there. So when we start to get a little descent of the organs and maybe some tension of the pelvic floor, if you feel pressure and heaviness, you might grip and draw up. Or if you have leakage, you might pull up on the pelvic floor. And like we talked about, there's many reasons why we'd have tightness. That bottom third starts to raise, and then we have the lowering of the organs, and sometimes we're more aware that the organ is there. So there are stages of prolapse. 1 and 2 is some descent. Stage 3, the organ is at your vaginal opening. You can see it. Stage 4 is the organ is completely out of your body. So I mean, we still treat stage 4 conservatively with managing your pressure. We have to understand that pressure management system. Can you breathe correctly? Can you move your pelvic floor so we can even get into strengthening? Because if you can't move it, then we're not going to have benefit from doing 500 exercises without actually being effective. So the pressure is going to be a really big aspect. Constipation is a driving factor for prolapse. So if we are not looking at bowel movements and the consistency, do you have to push or strain? Do you fully empty? Do you smear when you wipe? You might not be fully emptying. And the mechanics, because when you use the squatty potty, which I love, everyone should, it optimally positions your organs to empty. So if you have some prolapse, it will help optimally position the organs for urination and defecation to fully empty and to relax the pelvic floor. So we want to make sure the pressure is managed. We want to make sure that bowel movements are managed. And then we also want to start to get into the strengthening because, again, one of the functions of the pelvic floor is to support our organs. So we need to make sure that support system is working as effectively as possible. And we can absolutely reverse prolapse symptoms. And in some people with prolapse, it's connective tissue restriction. So once we release the connective tissue, the organs have more space to move around again. So strength is a big part of it, coordination, but also connective tissue.
Okay. Well, that's very helpful. And is there anything that you've seen where, I don't know, I would say that it's being mismanaged because people don't realize it's pelvic floor and you wish, like, I don't know, I see patients like that where I'm like, I wish they came sooner or had
Yeah.
referred sooner. Is there anything that you're like,
Yeah. Anything chronic, chronic low back pain, chronic hip pain. We're not getting to root cause. It keeps coming back. I don't, I always wish I can keep you out of pain if you come sooner. Also, pain with intimacy is a big one, and it might have been since you were younger. It could be new, but that's an indication that we're starting to get tension. I always try to encourage my pregnant mamas at least see me once pregnant, once postpartum. Yes, you can have pelvic floor pregnant. We don't have to do internal work while you're here. We can, again, do a lot to try to optimally position the baby. So that way, if it, to try to prevent breech or try to prevent stalling with labor, things of that, and make sure the uterine ligaments are released if they're tight. If baby's hanging out on the right side and the belly's shifted over, there's a lot we can do during pregnancy because your pelvic floor has to stretch 3 times its natural size to get out of the way for baby. So if you go in with a hypertonic pelvic floor, you're probably going to tear. So we can do a lot of things preventatively in pregnancy because that's a lot of times, unfortunately, where we see symptoms arise as postpartum.
Yeah.
People deal with pain all pregnancy. They're miserable. They have pubic bone pain. They have SI. They have sciatica. They have low back discomfort. I treat that. So why have a miserable pregnancy if we can get rid of it? So I think anything with pain related, and it's chronic or it's just debilitating, we are the people to see. We get down to root cause. It's not the traditional orthopedic PT or chiro or massage. Like we get deeper. And we can usually take you out of a flare.
Okay. That's awesome. Thank you for that.
Yeah.
And for people who are now like super pumped about pelvic floor therapy, as I am, hopefully, where can they find you?
Yeah, so I am in Sarasota off Bee Ridge and Sawyer. So I have my clinic actually in the same facility of Dr. Sandy, the chiropractor that you also spoke with. And I also have online programs that are available if you're not able to come in person or you don't have time, you don't have childcare, that come with one-on-one sessions. So it's not just an online program. What you're going to get is me. So I'm going to individualize a plan for you, but it's a little bit more for you to do at home on the exercise wise. But if you need the hands-on, you can still come in and see me. So I'm trying to create a really broad area to try to get as much help for pelvic floor for women as possible because I know time is of the essence, finance, there's so much that goes into trying to stay consistent, but this is an investment in your health. It's an investment in your quality of life. With your kids or with your family. I have people that just can't go on a hike because they don't know if they're going to have to pee the whole time. They're always looking for a bathroom. There's just areas of your life, maybe you don't want to be in a bathing suit, your diastasis never closed, you have low belly pooch and bloating. There's so much we can do to try to bring up your quality of life, your confidence, to help women regain control of their bodies and their life again, to help them try
Yeah.
to do their best.
And that's such an important point. And just one more thing I want to add to that is that it doesn't need to take that many sessions.
Right.
Because I know when I went to go see the pelvic therapist, I was having incontinence because I had hypertonic pelvic floor. And after like the first one, I was already like, wow, huge difference. And then after the third one, I was like, okay, cool. I don't really need you anymore. Like, I'll just keep doing my stuff at home. And that was it. So, like, it doesn't have to seem like daunting or overwhelming, you know?
No, and I tell people estimate 4 to 6 sessions. It could take a little less, it could take a little bit more, but it's not one of those I want you to come see me the rest of your life. I want to teach you the tools so you can manage this, you can pull from it, but also so you can have the literacy to understand your body and speak to a physician. I tried conservative. This is actually what's better and what's not, so we can get to root cause if it's not through pelvic floor therapy. I very rarely have to send somebody for hernia surgery or something like that. Usually we can do it conservatively, but some people, like, if you need it, you need it. So understanding what your normal is, so if you start to have vaginal dryness and things of that nature, maybe you need vulva or estrogen, vaginal estrogen. There's no shame in that. It's just what your body's lacking. So if we tried XYZ, that's not affecting or changing your leakage, it could be hormonal. Go see, Dr. Victoria
Yeah.
and see what we need to do for your hormones and things of that nature. So it kind of helps us narrow down if we can't get to root cause. Who do I go to next that's actually going to be able to help me piece together the rest of the puzzle?
Yeah, no, that's awesome. And I'll definitely share your links on here. And I have like the QR code for your course, that introductory thing that you gave me. So I'll try to
Yeah.
put that in there too.
Yeah. Awesome.
Yeah, well, thank you so much, Erin. I really appreciate you being on here. And you did such a great job of explaining everything that hopefully, we can just make this more accessible and I don't know, like easier for people to wrap their heads around.
Yeah, and hopefully take the stigma out of it, the taboo, the fear around it. I know it's like an uncomfortable place for a lot of people to be in, but it's so common and no one's really sharing it with each other unless you have a really close girlfriend. So
Yeah.
just letting people know you're not alone and there is treatment, there's a path, there's no need to suffer. We can get rid of it.
Yeah. Awesome. Well, thank you.
Thanks for having me on.
No problem.